Vascular Dementia by Erica Nicola. What is vascular dementia? Anyone who has been affected by someone with dementia can attest to the tolls it can take on not only the individual affected, but the people closest to them. Dementia is an umbrella term used to describe a group of symptoms characterized by behavioral changes and the loss of cognitive and social functioning. Vascular dementia is a decline in thinking skills caused by cerebrovascular disease, a condition in which blood vessels in the brain are damaged and brain tissue injured, depriving brain cells of vital oxygen and nutrients. When most hear dementia, Alzheimer's is usually the first in mind. Vascular dementia proves a very interesting topic due to the similarities of symptoms vascular dementia has with other diseases, often making it underdiagnosed. Surprisingly, vascular dementia is widely considered the second most common cause of dementia after Alzheimer's disease, accounting for 5 to 10% of cases. The demographic for vascular dementia is primarily those of advanced age, those who have suffered a stroke or heart attack, and those who suffer from atherosclerosis. Risk factors for vascular dementia are those who have had a stroke or TIA, hypertension, high cholesterol, heart or blood vessel disease, diabetes, and atrial fibrillation. Any disease or condition in which the blood flow to the brain is affected can put someone at risk for vascular dementia. Elomo states that vascular dementia has been one of the more difficult forms of dementia due to its symptoms do not fulfill all of the traditional criteria for dementia, although it has a significant impact of quality of life and ability to complete activities of daily living. The concept of vascular dementia has been recognized for over a century, but its definition and diagnostic criteria remain unclear and generate much confusion and debate, although several clinical criteria have been used for defining vascular dementia. The term vascular dementia substantially means disease with a cognitive impairment resulting from cerebrovascular disease and ischemic or hemorrhagic brain injury. Iwolo also states that the postmortem pathology shows 15 to 34% of dementia cases show a significant vascular pathology. This is interesting because studies have shown that vascular dementia is underdiagnosed. The pathology of vascular dementia can vary depending on which area of the brain has been infarcted. Factors defining subtypes of vascular dementia include the nature and extent of vascular pathologies, degree of involvement of extra and intracranial vessels, and the anatomical location of tissue changes, as well as time after the initial vascular event. When blood flow to the brain has been impaired, this causes damage to the brain, which can lead to vascular dementia. The signs and symptoms of vascular dementia can vary widely, depending on the severity of blood vessel damage and the part of the brain that is affected. While researching the signs and symptoms, one could see how easily these symptoms can be diagnosed for something else entirely. The Alzheimer's Association discusses that the symptoms may be most obvious when they occur soon after a major stroke. These can present with symptoms like confusion, disorientation, trouble speaking or understanding speech, and vision loss. Many of these symptoms are the telltale signs of a major stroke. The Alzheimer's Association also states that multiple small strokes or other conditions that affect blood vessels and nerve fibers deep inside the brain may cause more gradual thinking changes as damage accumulates. Common early signs of widespread small vessel disease include impaired planning and judgment, uncontrolled laughing and crying, declining ability to pay attention, impaired function in social situations, and difficulty finding the right words. Diagnosing vascular dementia would start with a series of professional assessments regarding memory, thinking, and reasoning. The Alzheimer's Association discusses that if screening suggests changes in thinking or reasoning, a more detailed assessment is needed. They also suggest in-depth neurological assessments of nerves and reflexes, lab tests including blood work and brain imaging such as MRI. The nurse's responsibility would be obtaining a health history, specifically including a familial history of dementia, evaluation of activities of daily living, and also input from a trusted family member or friend regarding any changes in the patient's behavior or personality. We can do many things to help reduce our risk of diseases that affect our heart and blood vessels that could in turn help reduce our risk of vascular dementia. These include not smoking, exercising, eating a healthy diet, limiting alcohol consumption, and keeping blood pressure within normal limits. It is important for us to be aware of the symptoms of vascular dementia as we care for the elderly population. Vascular dementia is a disease that all persons, especially those working with the elderly population, need to be aware of. Its similar presentation of symptoms with that of a stroke makes vascular dementia sometimes difficult to diagnose. As nurses, we can verse ourselves with the knowledge to recognize these signs and symptoms in hopes for more accurate diagnosis and treatment. References. Thank you.